Atrial and ventricular enlargement. Chapter 6. Cardiac enlargement, dilation, stretched congestive heart failure. Hypertrophy. Increased size of heart muscle fibers. Aortic stenosis. Cardiac enlargement, increase amount of cardiac tissue. How would this affect amount of depolarization? How could that affect an ECG? Right atrial abnormality. Overload of the right atria. Dilation. Hypertrophy. Increase voltage of the P wave. Right atrial abnormality. Normal P wave amplitude is less than 2.5 mm and 0.12 seconds in width. Abnormal P waves are typically taller than 2.5 mm but not longer than 0.12 seconds. Right atrial abnormality. Causes: pulmonary disease, congenital heart disease. Right atrial abnormality. Tall P waves in any of the following leads: 2, 3, of 4, sometimes V1. Right atrial abnormality. P pulmonal. Arterial enlargement due to severe pulmonary disease. Atrial enlargement can occur in the absence of tall P waves. Left atrial abnormality. Left atria normally depolarizes after the right atria. Left atrial enlargement should prolong the P wave greater than 0.12 seconds. P wave height may be normal or increased. Left atrial abnormality. CAD may produce wide P waves without left atrial enlargement. Left atrial abnormality. Leads I and or 2 may show notched P waves. Second hump due to delayed depolarization of the left atrium. P mitral, mitral valve disease. V1 may show a biphasic P wave. Negative part is greater than 0.4 seconds or 1 mm in depth. Right atria is anterior to the left atria. Left atrial abnormality. Causes: valvular heart disease, hypertensive heart disease, cardiomyopathies. CAD. Right ventricular hypertrophy. What do you think will happen to the ECG with ventricular hypertrophy? Normal QRS. V6. V6. V1. V1. Figure 4.6. Normal QRS. V1. V6. Right ventricular hypertrophy. Consider right ventricular hypertrophy and V1. Normal. Hypertrophy. Right ventricular hypertrophy. In V1, R wave is greater than the S wave. In V1, T wave inversion, reason unknown. Right axis deviation. Right ventricular hypertrophy. Causes of RVH. Congenital heart disease. Atrial septal defects. Others. Emphysema may mask signs of RVH. Left ventricular hypertrophy. With LVH, the electrical balance is tipped even further to the left. Predominate S waves in the right chest leads. Tall R waves in the left chest leads. Left ventricular hypertrophy. If S wave in V1 plus R wave in either V5 or V6 greater than 35 mm, not specific indicator. R wave greater than 11 to 13 mm in navel. ST segment changes. Left axis deviation. Left atrial abnormality. ST strain patterns. Left ventricular hypertrophy. Causes: hypertension, aortic stenosis, risks of LVH, congestive heart failure, arrhythmias.